For most of us, the idea of getting a shot is, well, it's not fun. We might wince, maybe look away, feel a quick little sting. But what happens when that simple discomfort spirals into something way bigger? An overwhelming, all-consuming fear. Well, that's exactly what we're going to dive into today. A phobia that goes far, far beyond just not liking needles.
It's a really fair question, right? How can this tiny, sterile piece of metal trigger such a massive reaction in some people? For those who experience it, that fear is incredibly real. It's this powerful, consuming anxiety that just completely takes over. And it actually has a name.
So let's actually put a name to this. When that fear becomes so intense that it starts to change how you live your life, it's no longer just a case of the jitters. It's a recognized clinical phobia, and understanding what it is, that's the first step to seeing the whole picture.
And here it is, trypanophobia. Now, what's really interesting on this slide are those key words. You see, intense and irrational? That means the fear is totally out of proportion to the actual real danger. And extreme anxiety tells us this isn't about the physical pinch of the needle, it's a deep, psychological response that can take over your entire body in any kind of medical setting.
So where does a fear this powerful even come from? And what does it actually feel like to go through it? Let's dig into the roots of trypanophobia and look at the very real ways the body and mind react when faced with this trigger.
Well, a lot of the time, the roots of this fear are buried in our past. It could be a single, really painful injection, especially when you were a kid, Your brain is learning what's safe and what's dangerous, and that one moment can create this powerful, lasting danger signal. For other people, it's tied to a bigger anxiety about pain or injury in general, and sometimes it can even be a symptom of an underlying anxiety disorder. It's almost never just one thing, but a mix of these factors.
This slide just perfectly illustrates the two-front war someone with trypanophobia is fighting. Mentally, just the thought of a needle can set off a full-blown panic. And at the exact same time, the body physically reacts. We're talking sweating, shaking, feeling sick, sometimes even fainting. This isn't a choice. It's an involuntary, full-body alarm system going haywire. So when you have this kind of intense reaction, it leads to a very logical, but also a very dangerous behavior. I mean, if something causes that much distress, you do everything you can to stay away from it, right? But in this case, that avoidance creates a really serious problem.
Yep, that fear translates directly into avoiding doctors, nurses, and clinics. This is so much more than an inconvenience. It's a huge barrier that stands directly between a person and their health, and that can have some pretty serious consequences.
And what are we talking about here? What exactly gets avoided? Well, think about it. Routine vaccinations that prevent serious diseases, essential blood tests that can diagnose critical conditions, injections for managing illnesses like diabetes, even just basic annual checkups. The fear can literally force a person to miss out on critical and sometimes life-saving medical care.
Okay, hearing all of that can feel pretty heavy, I know. But here's the thing, and this is the most important part of the story. There's absolutely a way forward. This is not a life sentence. So let's look at the real, actionable steps for managing this fear.
This right here, this is the core message. This phobia is not something you just have to live with forever. As it says right there, with the right treatment, people can and absolutely do learn to manage this fear. They can get to a place where they can receive the medical care they need to stay healthy.
So what does that treatment actually look like? It's usually a multi-step approach. Therapy is a huge component, especially methods like cognitive behavioral therapy, or CBT. That's all about learning to identify and challenge those irrational thoughts that are fueling the fear. Changing the thought from, this needle is going to be unbearable, to, okay, this is a quick, safe procedure that's going to keep me healthy. It's often paired with coping techniques like deep breathing, and in some severe cases, medication can be an option too.
If there's one thing you take away from all this, let it be this. Trypanophobia is treatable. That's the bottom line. No matter how powerful and overwhelming this phobia feels, there are proven, effective strategies to lessen its control over your life and your health. Hope isn't just a nice idea here. It's a clinical reality. And that brings us to a final thought. A question, really. Whether this is about you or maybe someone you care about, what could be reclaimed if this fear wasn't in the way? What peace of mind? What level of health? The path forward really starts with understanding that you don't have to face it alone.